good day everyone. I am Guadalquiver from BSN 12L Group 46, and so for today I'm going to perform a proper demonstration about the parental medication administration. So the parental medication administration consists of the intravenous, intradermal, intramuscular, and the subcutaneous. However, in this return demonstration, I'm going to perform the intramuscular. So intramuscular medication is used in vaccines, and also this enters the body through the capillaries and the circulatory system. So first and foremost is we need to check for the doctor's order. Next is we need to check for the medication administration record. Next is we need to check for the label of the medication carefully against the EMAR. This is to ensure that the right medication is being prepared. And also follow the 3 checks in administering medication. Read the label of the medication. So first is when it is taken from the medication cart. Second is before withdrawing the medication. And third, after withdrawing the medication. And also organize all the equipment to be needed. So we have the syringe. We also have the sterile water, which will serve as our improvised ampoule and vial. We also have the cotton ball soap in cleansing solution. We also have the gloves, and we also have the waste receptacles. And also don't forget to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. So now we are going to prepare the medication from ampules. Prepare the medication ampule for drug withdrawal. Since I don't have an ampule, I will use the sterile water as my improvised ampule. So flip the upper stem of the ampule several times with a fingernail. Uses an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck. And break the top by bending it towards you to ensure that the ampule is broken away from yourself and away from others. And place the antiseptic white packet over the top of the ampule before breaking it to the top. And dispose the top of the ampule in the short container and discard. And withdraw the medication. So place the ampule on a flat surface and attach a filter needle or straw to the syringe. So remove the cap from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft. So with a single dose ampule, hold the ampule slightly on the side if necessary to obtain more than the ordered amount of medication. And dispose the filter needle by placing it in a short container. And the filter needle. If giving an injection, replace the filter needle with a regular needle, tighten up the cap and the half of the needle, and push solution into the needle and to the prescribed amount. So I already closed the door, fixed the curtains, adjusted the temperature, and provide adequate lighting for my patient's comfort and privacy. Hello ma'am, good day. How are you feeling today? Okay, great. So it is important to greet the client in order to establish a good rapport between the healthcare provider and to the patient. So ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? And is your birthday? How would you like me to call you? Okay, great. So ma'am Jenny, the procedure that I'll be doing is I'll be administering you a intramuscular medication. So intramuscular medication, I will administer this medication on your muscles. And also this medication is used for antibiotics and vaccines. And also there are certain procedures that you need to follow. Is that okay with you ma'am Jenny? Any concerns or any questions? Okay, great. So it is important to explain the procedure of the assessment to the patient so that they will know how can they participate on the assessment. So before doing the assessment, assess the client to a supine, lateral, prone, or sitting position depending on the chosen site. If the target muscle is the gluteus medius or the ventrogluteal site, have the client in the supine position, flexing the knees in the lateral position, and flex the upper leg in the prone position and toe in. Select and locate and cleanse the site. Select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be frequent, alternate sites. Avoid using the same site twice in a row. Locate the site for injection and apply clean gloves, and also clean the site with an antiseptic swab in using a circular motion. And discard the cotton ball. And now, transfer and holds the swab between the third and the fourth fingers of your non-dominant hand in readiness for needle withdrawal, or position the swab on the client's skin above the intended site. and prepare the syringe for injection and remove the needle cover and discard without contaminating the needle. And discard. Now, if using a pre-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. In this does occur, swipe the medication off the needle with a sterile gauze. Inject the medication using the Z-trap technique. Uses the ulnar side of the non-dominant hand, pull the skin approximately 2.5 centimeters or 1 inches to the side under some circumstances, such as for emaciated client or infant, the muscle may be pinched. Holding a syringe between the thumb and the forefinger, as holding a pen if the skin is quickly and smoothly at 90 angle, and hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand and aspirate for 5 to 10 seconds. If blood appears the syringe, withdraw the needle and discard the syringe and prepare new injection. And if blood does not appear, inject the medication steadily and slowly, approximately to 10 seconds or millimeters, while holding the syringe and steady using the ventrogluteal site. And after injection, wait 10 seconds of using the ventrogluteal site and withdraws the needle. Withdraws the needle smoothly at the same angle of insertion and apply gentle pressure with the site with a dry sponge if it is not necessary to massage the area of the site of injection. And if bleeding occurs, apply pressure with a dry of sterile gauze until it stops. And activate the needle safely, device or discard the uncapped needle and attach syringe into the proper receptacle. And remove discard gloves and perform hand hygiene. So now, document all the relevant information, including the time of administration, drug name, dosage, and the route, including the client's reaction. And now, assess the effectiveness of the medication as it is expected to act. And that's it. That's my proper demonstration about the parental medication.